everything from routine exams and cleaning to restorative work, such as fillings, inlays, and crowns. A little more about myself, what I actually do at Orange Dental Arts. I'm a treatment coordinator, and what that is I verify insurance beforehand for patients and then explain their insurance benefits to them after they've been diagnosed. And then from there I take care of scheduling and payment of procedures that they choose to do. So Dr. Mark Wynn is the doctor at our office, and he is native to Orange County. He grew up in Fullerton, and he actually studied at NYU and came back to Orange County to practice. So today I was going to cover the most frequently asked questions that we get in our office about dentistry, and I'm actually going to have a little audience participation, see if anyone knows the answers, and then I can cover them a little more fully. So first, a common question that we hear is whitening bad for your teeth? So does anyone think they know the answer to that? Whitening bad for your teeth? Good. Well, one thing that people do need to consider is, as with anything, you can overdo whitening. And when you overdo whitening, you can break down the pores in your teeth. But just doing whitening regularly is not bad for your teeth. The reason that teeth get discolored is that food and drink seep into the pores, almost like skin, but with teeth. They seep into the pores of your teeth, and then they cause staining. And what whitening does is it kind of cleans out those pores, so to speak. So we offer Zoom whitening in our office, which is a 1-hour procedure. And we also offer take-home whitening gel, which you use in conjunction with whitening, custom-fit whitening trays. And you put it on for 30 minutes every day until you reach the desired color of the teeth you prefer. And then to just keep that up, you use it every 2 weeks to every month just to maintain that. So those are some of the whitening that we offer in our office. Okay, so the next question. What food or drinks damage teeth? Yes?
Coffee.
Of course, coffee. Anything else? Yes?
Tea is worse. Tea does, yeah.
Yes.
Does
Yes, Lori?
sodas.
Exactly. Very much so, especially the carbonation. Anyone else? Yes?
Popcorn.
Popcorn. Yes, a lot of people don't realize that food as well as drinks can be bad for your teeth. And so a lot of you were mentioning different drinks that stain your teeth. Definitely. Also red wine and even white wine. A lot of people think that only red wine can stain your teeth. White wine also does. So what a good way to prevent that staining of the teeth is by drinking through a straw. Of course, I know people aren't going to drink tea or coffee through a straw. Another good way is if you add cream or milk to your coffee, it helps dilute that. Or even just rinsing out your mouth or drinking coffee in conjunction with water. And the best way to prevent the staining is just to brush your teeth after you know you're having one of those type of beverages. Also, too, a lot of foods that require hard crunching, you don't want to bite those on the anterior of your teeth, your front teeth, because that's how a lot of people chip their teeth. We see it very commonly. Something that's hard to chew, something that's very crunchy, you definitely want to chew on your back teeth. That's what they're there for. Okay, so the next question, a little tricky. How often should you see the dentist? For some, yes, every 3 months. And yes?
Very individualized. If your teeth are in pretty good shape, probably can do it twice a year, but as you age sometimes, because you've got gum issues, it could be 3 or 4 times a year.
Perfect answer, exactly. The answer was definitely every 6 months. You definitely want to see the dentist twice a year. A lot of times people think once a year, but actually twice a year is common for most individuals. Depending on your gum health, you may need to be seen every 4 months, possibly even every 3 months as recommended by your dentist. The first mistake that people usually make is by only going to the dentist when they feel pain. And I hate to see that, because usually when you get pain, that means that you're having an indication that pulp tissue is exposed, or you could even have an infection in the root. So you're looking at major procedures such as root canals, retreatment of root canals, and major restorative work like crowns to get the tooth back into its normal condition. So the best way to save your teeth is by prevention, by making sure you keep that every 6-month appointment, or if the dentist has told you in the past every 3 months. Make sure that you keep that up. And also, too, nothing can beat your daily oral hygiene. Dentists can only do so much, but if you're not doing your part at home by daily brushing and flossing, then it's going to break apart all the efforts that your doctor has been doing for you. So the next question, do mechanical toothbrushes work better than regular toothbrushes?
Yes.
Yes. Any other thoughts on that? Okay. Actually, yes. And the reason that they work better is because they actually do a lot more work and a lot less effort than a manual toothbrush would. With mechanical toothbrushes, they have a rotating head bristle that kind of turns like a doorknob turns left and right. And so what that does is it actually breaks apart more plaque than when you're just brushing laterally with a regular toothbrush. Another reason too that the mechanical toothbrushes work so well is that they have an RPM that usually makes them rotate between 6 and 32,000 rotations per minute, depending on the type of mechanical toothbrush you have. So definitely a lot more efficient than your hand toothbrush could ever do. And also too, a lot of mechanical toothbrushes come with timers, which help you to take the full 2 minutes brushing your teeth. Because a lot of times if we're not timing ourselves, I'm pretty sure nobody here brushes full 2 minutes every day. And it's natural unless you're being timed. And with a mechanical toothbrush, a lot of them have timers where you give a full 30 seconds to each quadrant of your mouth. And so that way you're actually brushing for the full 2 minutes. Okay, and my last question is a true or false. It's pretty easy. Okay, true or false, you should floss every day.
True.
Yes, true. A reason for that is because it actually takes 24 hours for plaque to become tartar. And what tartar is, it's kind of almost a calcified type of plaque. And it can't be removed anymore by a toothbrush. It actually needs to be removed by a dentist. So it's very important that you remove food particles and plaque in between your teeth every day. Now, also another reason is that food particles that are left in your mouth breed bacteria. And what that bacteria can do is it can lead to infection and inflammation of the gums. A term that many of you have probably heard of is gingivitis. And that's a lot of times caused because there's that bacteria that gets stuck in your mouth and causes the inflammation, causes the bleeding of the gums. So you definitely don't want that to happen. You just want to floss every day. So a great way to refer Orange Dental Arts definitely would be anyone new to the area, especially if you're dealing in real estate, dealing with people that you know are new to the area. They're probably very interested in looking for their houses, new jobs, maybe even a new regular doctor. And a lot of times looking for a dentist is not their #1 priority. So you can actually help with their moving process by even just saying, hey, we know a great family practice, Orange Dental Arts, and just giving them my card. So that's a great referral. Also too, anyone who has a new job, because if you have a new job, chances are you either are getting new benefits or are losing dental benefits. And we take insurance patients as well as patients without insurance. And we have the great new patient special still on, the $49 for x-ray exam and cleaning for those without insurance. Also too, like I mentioned in my 30-second presentation, anyone who maybe has an upcoming wedding and wants to do some cosmetic dental work, even if I notice people in a wedding party, sometimes they want to get veneers done, they want to get whitening done, they want to just make sure that they have that end goal of the wedding, and they want to get everything done by then. So that's also a great referral. Now I passed out a brochure for Care Credit. Everyone should have one. What that is, it's a third-party financing that we offer in our office, and a lot of people aren't aware of that. With Care Credit, you can actually spread out extensive dental work payment into 3, 6, 9, 12, and sometimes even 24 months with 0% interest. So that's a great referral tool for people who think, I have so much dental work to do, I'm not going to be able to afford it all. It's something that they do apply for. Their credit is ran. They can go with a cosigner too as well. So that's a great referral tool if you just want to get that brochure out to anyone. So does anyone have any questions? Yes?
How much is to do the wedding? Because a lot of times people can't afford to do the wedding part of it. So how much do you typically charge to
The Zoom, the 1 hour? The 1 hour, it's typically $299 for BNI, and for referral for BNI, we do it for $249. It's about an hour and a half long appointment, just because we do prep you for that half an hour beforehand.
And typically how long does that last?
What that does is that'll whiten your teeth to whatever they were naturally at. So a lot of people think they're going to get, like movie star white. You only get as white as your teeth were before staining. And that will last as long as you're not eating or drinking things that stain. So a lot of times what we get for people who do the Zoom, we do for free the custom fit whitening trays, and we'll give you some take-home gel so you can maintain that look. After Zoom whitening, you probably only want to do the gel about once a month just to maintain the white. Any other questions?
Did you say that this whitening also includes the trays or is that?
Yes, no, we do that with our, it's not hard. They just get custom fit and you come back in about a couple of days and we have the trays ready for you.
What's movie star whitening?
Well, I would say a lot of times people think like the Zoom whitening is going to get your teeth almost like the color of veneers. But a lot of times some people do have naturally with whiter teeth than other people. So if your teeth are naturally that white and you know that if you're a smoker or drink a lot of coffee and you just know there's a lot of staining on there, then they're going to get back to that point. But if you have always kind of had teeth that aren't that white,